And now we are coming back to the USA, where Ms. Diana Cantu-Reyna is ready. She is a registered nurse specialist and an integrative health educator. She is the founder of the organization called Cultivating Self. It's a movement supporting healthcare leaders to restore cultural, spiritual, and ecological foundations of healing within modern healthcare. Diana is also an integrative health coach trained in Western herbalism and trauma-informed yoga practices. I'm happy to have Ms. Diana Cantu-Reyna with us online today. Good afternoon from Czech Republic. Good morning to the USA.
Thank you very much. It's a pleasure to be here. I'm going to go ahead and share my screen. Okay, wonderful. So again, thank you all for having me. It's truly an honor to be here with you today, and good morning from the San Francisco Bay Area in California. I am here to discuss the great dilemma that we face in healthcare and offer some perspectives and also open up to you all for some questions. So, cultivating self, we are birthing a new culture of care. Oops, excuse me. So I just also, before we begin, I just want to take a moment to offer some gratitude to the organizers of this beautiful conference, all the work that goes into this, the tech support. Thank you all for your efforts. I know a lot of it goes unnoticed, and without you, this wouldn't be possible. So just wanted to acknowledge you all. I also want to honor the land and the ancestors who tended it before us. The land where I sit is traditionally of the Karkeen people in the Karkeen region, again known as the San Francisco Bay Area. And we're just so grateful to call in their wisdom with us, our ancestors to be with us today, and may we continue to carry that wisdom forward to really birth this new culture of care. So who am I? Thank you for the introductions. We had a little bit of information of who I am, but I'm a sister and aunt. I'm a registered nurse. I'm also the child of immigrants who left their ancestral homelands in search of greater opportunities for their children, both of whom are in the healthcare space. My father's a physician, trained in Mexico, and my mother's an occupational therapist. So I grew up watching them support their community and also have to assimilate to a completely different culture that really was devoid of a lot of the values that they held so deeply. And it was very challenging to witness them in the healthcare space and not be supported. And it definitely affected all of us as their children. I'm also a patient advocate, an herbalist. I have clinical experience across various settings, including the pediatric trauma ICU is where I started my nursing career, public health, rural health, a nurse case management. I worked on the street with doing wound care with our homeless population, primary care, and as well as concierge medicine. So after experiencing burnout myself and feeling the impact of the healthcare system, which led to moral injury, I founded Cultivating Self, which is a nonprofit that was set out to restore the spirit of healers and reconnect us all to healthcare from the lens of culture and spirit, as well as ecological wisdom. And here we have some interesting graphs. We don't need to go into too much detail about these, but the intention of sharing these with you today is to really show the data. And I'm speaking from the lens of the USA. Our healthcare system, as many of you all know, is pretty shameful. And so we can see this reflected in the numbers here. This is the Mirror 2024 study, which is demonstrating the failed US healthcare system in comparison to 10 other countries. And so again, we can see from a couple of the graphs here that the US has the highest healthcare spending and the worst outcomes. compared to other nations. It looks like Australia, the Netherlands, trending at the top here. And this is just really interesting because when we ask this question of spirituality, and the talk today is, integrating ecology and spirit and culture to heal the healer so that we can build new systems, we really have to look at the economics behind what's driving the outcomes. And so we can see here again that we have horrible outcomes and we are spending the most. Again, here, the US trail peers for equity and healthcare access. We also know that our Black and brown, what we call Black and brown, but the Latino American community, also African American communities, have the worst access to healthcare. And then I even push it a little further and ask the question, what kind of healthcare are we accessing? Is this integrative of the medicines that you have all been sharing here today? Is it aware of the spiritual and greater historical context from which we are arriving in front of the healthcare providers? I would say no. And so this really then leads us to the question of my thesis for this talk, which is our disconnection from the spirit is at the root of our healthcare crisis. And if we go back a little bit, we can see some commonalities in our cultures and across our ancient cultures. Health was never separate from the spirit. Every tradition taught that well-being comes from feeding both the human and the spirit world through ritual, ceremony, and relationship with the land. We can see that the medicine wheel here of Turtle Island, which is where I reside, holds a balance among body, mind, heart, and spirit. In the African cosmovision, health depends on reciprocity with ancestors and alignment with the cosmic order. And then in the top right of the screen, we have the Andean Inca Chacana, which reflects harmony between the upper, middle, and lower worlds. We also have the Panchakoshas in Yoga and Ayurveda, which describe the five sheaths of being. You have body, energy, mind, wisdom, and spirit, each requiring their own nourishment. We can also look at Chinese medicine with the five elements and Ayurveda's doshas as well, that echo this same truth that cross all of our cultures around the world. And together, these teachings really remind us that food, prayer, story, and ceremony do not just nourish the body, but they feed our spirit. They also honor our ancestors and keep us in harmony with the web of life. I really love these visuals because you can see so many similarities here. And now as we come to our current medical system, we can see that these are some of the nursing, and I'm speaking from the nursing perspective. These are some of the nursing frameworks that we use when we talk about patient-centered care. And it's really interesting to see what's on here. And nowhere does it say spiritual support. And we do offer spiritual support to patients in the hospital setting, but many times we are never offered that same spiritual support. So what's possible? Here, these are some examples that are happening around over here as in North and South America. We have Ecuador's first Indigenous university proves to be a big hit. We also have First Nations University in Canada, which is at the forefront of Indigenous-led research. And I ask this question, what's possible when we start to really lead with the Indigenous values that connect us back to that spirit? What is possible with our economy? What kind of cultures of care and healthcare systems? Maybe we don't even call it healthcare. What about the love-based systems of care that we can build together? So Cultivating Self, as I briefly shared before, I'm the founder of, this is a nonprofit that is doing a lot of work in the realm of reweaving spirit, culture, ecology, so that we are integrating that into the mainstream healthcare system while also simultaneously creating a new one. We empower caregivers through holistic continuing education, ecological restoration projects, and civic education so that they're empowered to change policy in their hometowns and their communities. These are some of the projects that we've done. We've done healthcare retreats where we bring in world-renowned teachers from around the world to talk about ancient modalities of healing. We do organizational well-being retreats, and again, as I said, continuing education and science-based play shops. These are all pictures from our events and our gatherings. We have also created regenerative healthcare spaces in the hospital setting. This is actually one of my colleagues who took a little selfie to share his appreciation for what we created was a reset room, a space for all of the hospital staff to reset and to ground and to find some peace of mind amongst a very chaotic setting. Some calls to action for us here. Um, Interfaith healing spaces that are not necessarily religious, but really connecting us back to spirit. And one of the things that I actually forgot to share earlier was when we talk about spirituality, what does that actually mean? And I'm just going to read a quick sentence from the book called One Drum by Richard Wagamese, who is a Ojibwe First Nation, Northwestern Ontario storyteller. And his definition of spirit is the word spiritual itself means of the spirit. We are all spirit. We are all energy. The truth is that there is a fire that burns at the invisible center of all of us. So we really also have to define what spirit means. And also to me, spirituality is just the interconnectedness of all things and having that awareness and walking in the world with that awareness. Connection to land, to culture, to ceremony, and making sure that that is integrated into the care that we offer to our communities. Cultural immersions, shared wisdom, Indigenous-led higher education, as I showed you examples that are actually happening right now, and ultimately legislation and policy change. Thank you. Please stay connected. That is our contact information. And if there's any questions, I'm happy to answer them and engage more.
Thank you, Diana, for being with us today, and thank you for sharing your ideas what spiritual approach and spirituality means in your point of view. So we thank you very much for that, and
Thank you.
wish you a nice day in San Francisco Bay. Thank you very much and goodbye.